الاوستيوارثروسس أحيانا يسموه osteoarthritis. Osteoarthrosis and osteoarthritis are actually the same. بس because it's not purely an inflammatory condition, لذلك it's better to call it osteoarthrosis. هسه بالعربي نسميه تعمر المفاصل أو بالدارج يسموه سوفان المفاصل. Actually the osteoarthrosis is the commonest joint disease. The commonest joint disease. وبعد it is the aftermath of almost every joint disease. يعني ممكن أي joint disease complicate into osteoarthrosis. It is important to know about this condition, to know about its outlines. هسه الاوستيوارثروسس هو عبارة عن، إذا أريد نعرفه تعريف علمي, scientifically speaking, it is degeneration of the articular cartilage. The articular cartilage. The articular cartilage اللي هو يكون at the end of the bone and it participates in making the joint. The articular cartilage ليش يصير degeneration؟ لازم نعرف شوية نبذة about its function and about its structure. What's the function of the articular cartilage? It got two functions. First, it increases the joint stability. وبعد, more importantly, it distributes load. It distributes load. هاي الوظيفة اللي هي أكثر أهمية. Load distribution. بدل ما يصير عندنا load concentration on certain points, الكارتلج عنده physical characteristic إنه يوزع اللود مال الجسم, dissipates the load حتى ما يصير عندنا load concentration, وهذا يسبب لنا destruction at certain points. فهذه أهم وظيفة. زين. Structure. الارتيكولار cartilage يتكون من these three components اللي هم ground substance. الground substance هي عبارة عن protein. Actually it is a glycoprotein. It's called the proteoglycan, يعني protein and carbohydrate molecules زائدا hyaluronic acid. hyaluronic acid. بعد عندنا collagen fibers. collagen fibers, both the collagen fibers and the ground substance are secreted by the cells اللي هم الchondrocytes. collagen fibers, ground substance and chondrocytes اللي هي they secrete these chemicals. هسه as a substance, as a physical substance, كمادة فيزيائية, the cartilage, it got a compressive strength. Compressive strength يعني قابلية الكارتلج على مقاومة الcompressive force, القوة الانضغاطية. the compressive strength, it comes from the proteoglycan. Okay? في حين tensile strength اللي هي بالاتجاه المعاكس, اللي هي the resistance of the cartilage against destruction forces, it comes from the collagen fibers. Okay. زين. osteoarthrosis إذن بعد ما عرفنا what is the articular cartilage, osteoarthrosis is degeneration of the articular cartilage, as simple as such. هسه إذا نباوع على هاي الصورة نشوف بأنه عندنا femur head in the upper part of the picture. The femur head, it's normal, ما بي أي degeneration. بالصور اللي جوا نشوف بأنه الكارتلج underwent degeneration. Some areas are completely lost بحيث يكون bone is exposed, the subarticular أو subchondral bone, it's exposed. وإذا نباوع على الإكس راي نشوف بأنه joint space it's lost. joint space اللي هو الفراغ اللي بالمفصل اللي هو يمثل الكارتلج, لأنه الكارتلج it doesn't show on X-ray, فيبين كأنه العظام مال الجوينت they are immediately against each others because of the loss of the cartilage. Okay, so this picture shows osteoarthrosis. زين. Pathologically speaking ايش راح يصير؟ احنا قلنا بانه degeneration of the articular cartilage. بس ليش يصير degeneration of the cartilage؟ هسه الcartilage of the joint كأي cartilage in the body it got no blood supply. ماكو blood vessels. Okay. ف it depends on certain physical forces. يعتمد على قوة فيزيائية inside the cartilage for supply of nutrition. هاي الفيزيكال فورسز نسميها الامبيبيشن بريشر. امبيبيشن بريشر مر عليكم اكيد بالفسيولوجي. الامبيبيشن بريشر هذا يخلينا النيوترينت get inside the cartilage حتى to keep it surviving. هسه الامبيبيشن بريشر يصير وياه changes. هذول changes they occur with time يعني with aging or it occur with any condition that causes depletion of the proteoglycan. Okay. فشي يصير عندنا كخطوة أولى depletion of the proteoglycan, loss of the proteoglycan. هذا ايش راح يسوي لنا؟ decrease water content. انتوا تعرفون بأنه البروتين content of the tissue it is in direct relation to the water content. Okay. فلذلك راح يصير عندنا decrease in the water content. هذا راح يقلل لنا الامبيبيشن بريشر اللي حكينا عنه اللي هو causes the nutrients to go inside the cartilage. فيقلل لنا النيوتريشن. This causes damage to the chondrocytes. The damage to the chondrocytes of loss of the nutrition يخلينا الchondrocytes release lytic enzymes. Lytic enzymes they cause more damage to the collagen fibers and the other chemicals. It's here like it is an empty circle, like a vicious circle, more depletion, more loss of the hydration and imbibition pressure, more damage to chondrocytes, and so on. Okay, so once the osteoarthrosis starts, it is progressive. Okay. As a pathological features. What are the pathological features that we see in case of osteoarthrosis? أول شيء أكيد راح يصير عندنا cartilage destruction. It is the hallmark العلامة المميزة. و it is progressive مثل ما قلنا. It is progressive. بعد يصير عندنا subchondral sclerosis. Subchondral يعني العظم اللي يكون تحت الكارتلج. Subchondral bone sclerosis. أوكي. طبعا ليش يصير سكليروسيس؟ واضح السبب اللي حكيناه قبل شوية. قلنا أنه the most important function of the cartilage is to spread the load. يوزع load on the underlying bone. بس من يصير عندنا loss of this function no more load distribution فيصير load concentration في البون يصير ب like micro stress fractures. هذول المايكرو stress fractures they heal by sclerosis. فنشوف أنه أكو subchondral sclerosis. بعد osteophyte formation. Osteo يعني عظم وفايت يعني فنجس بس هي ما لها علاقة بالفنجس. الأوستيوفايتس هي عبارة عن bony projections عبارة عن زوائد عظمية أو نمو عظمي. Okay. It occur because of release of growth factors. لما يصير عندنا destruction للcartilage فكرد فعل الcartilage it tries to regenerate itself. There is a release of growth factors. The growth factors هاي تسوي لنا formation of a new bone and a new cartilage. فيكون على شكل osteophytes. طبعا يكون هذا ال kind of regeneration it's useless. يعني يكون بالأماكن اللي ما إلها أهمية. it doesn't regenerate the cartilage in the regions that are important for weight distribution وإنما يصير on the margins of the joint. It's actually bone and joint formation, but it is useless in stopping osteoarthrosis. بعد characteristic pathological feature هي subchondral cyst formation. Subchondral مثل ما قلنا هو البون it is beneath the cartilage و cyst formation تتكون عندنا مناطق خالية من العظم على شكل cystic lesions. طبعا السبب مالتها غير معروف ليش يصير cyst formation لكن they think أنه it is because of increased pressure inside the joint so it could be like pumping of some of the synovial fluid inside the bone or it's because of necrosis of certain areas of the bone because of the over pressure. Okay. بعد آخر شيء capsular fibrosis. Capsular fibrosis. إذا تذكرون أنه قلنا أنه one of the functions of the cartilage is to provide stability of the joint. Important for the stability. فمن يكون عندنا loss of the cartilage the joint is no more stable فيصير عندنا as a compensation fibrosis of the cartilage trial at resuming the stability. Okay. Progressive cartilage destruction, sclerosis, osteophytes, cyst formation, and capsular fibrosis. These are the pathological features of osteoarthrosis. So this is an X-ray. إذا تركزون, this is a knee. وإذا تشوفون أنه there is loss of the joint space, mostly on the medial side, لأنه when the knee is affected, the medial compartment is the most to suffer. And you see that the space is narrowing. There is osteophyte formation. If you focus on the side of the loss of the joint, نشوف بأنه at the margin there are bony projections. These are the osteophytes. بعد نشوف أكو sclerosis. أكو حتى loose body يعني عبارة عن قطعة من العظم و actually it is surrounded by cartilage but we can't see the cartilage on the X-ray و it is freely moving inside the joint نسميه loose body. طبعا loose body it's originally an osteophyte but it got separated and now it's freely moving inside the joint. Okay. Risk factors. ليش يصير عندنا osteoarthrosis? On top of the list is aging. It's aging. It's kind of degenerative disease. Okay. بعد traumatic conditions like fractures, intra-articular fractures. تذكرون دائما احنا نردد أنه intra-articular fractures should be perfectly reduced. Otherwise, إذا بقى عندنا أكثر من 2 millimeters displacement, then it predisposes for osteoarthrosis. بعد ممكن dislocation of the joint. ممكن ligamentous injury تسبب لنا instability predisposes for osteoarthrosis. بعد another risk factor is obesity. Obesity يعني it's joint overload. With time the cartilage is lost. بعد any joint disease. Most joint diseases they can end with osteoarthrosis like rheumatoid arthritis, septic arthritis, psoriatic arthritis, avascular necrosis, reactive arthritis, etc. Any joint disease can complicate into osteoarthrosis. بعد family history نشوف أنه certain families there are multiple members affected by osteoarthrosis. usually أنه لما يكون عندنا family history of osteoarthrosis it tends to be polyarticular يعني affects more than 1 or 2 joints. most joints affected by osteoarthrosis include the knee, the cervical spine, and the lumbosacral spine. بس نشوف أنه الناس اللي عندهم family history could suffer from osteoarthrosis at other joints. okay. بعد occupation يعني بعض الناس عندهم عمل يتطلب exercise أو بالأحرى over exercise of certain joints. such joints could start suffering from osteoarthrosis. The clinical features. What are the clinical features that we see with osteoarthrosis? أول شيء, what are the joints which are affected? مثل ما اتفقنا, the knee joint is on top of the list. بعد عندنا الspine, especially the cervical and the lumbosacral region. بعد عندنا hip, but it is less common than these unless it is secondary to something. بعد joints of the hand اللي هن the DIP joint اللي هو distal interphalangeal joint. okay. وهسه راح نشوف another joint in the hand is also commonly affected. بعد clinical feature, males and females are affected equally. okay. بس polyarticular بالfamily history females are affected more. بعد pain in osteoarthrosis, it passes through relapse and remission. يعني نشوف بأنه البيشنت اللي عنده osteoarthrosis يشكي من آلام وstiffness, limitation of motion إلى آخره. وبعدين تجي فترات قد تستمر أسابيع وحتى أشهر يعني feels well. زين. osteoarthrosis passes through relapse and remission. stiffness. okay. بعد swelling قد يجي البيشنت اللي عنده osteoarthrosis with swelling. والswelling قد تكون نتيجة joint effusion يعني تجمع سوائل inside the joint. تجمع السوائل inside the joint with osteoarthrosis نسميه sympathetic effusion. ليش sympathetic effusion؟ لأنه it's kind of a trial of the joint to minimize the friction and the overload. فيصير عندنا synovial hypertrophy, والsynovial hypertrophy يسبب لنا over secretion of synovial fluid فيصير synovial sympathetic effusion. بعد قد يكون مو بسبب السويلنج, not because of the effusion but because of big osteophytes اللي حكينا عنها قبل شوية, وقد يكون بسبب الكابسولار fibrosis. okay. بعد deformity لأنه مثل ما اتفقنا قبل شوية الارتيكولار cartilage will be eroded, راح يروح destroyed. والsubchondral bone also in advanced stages also it will be destroyed. هسه مثل ما نعرف بأنه the joints of the body, the biomechanics of the joints of the body usually ما يكون عندنا loading of both sides of the joint medial و lateral يكون equally. This is the normal. okay. فمثلا مفصل الركبة knee joint, the loading on the medial side is more. okay. فمن يصير عندنا osteoarthrosis, more cartilage, more bone will be affected on the medial side. فيصير عندنا بمرور الزمن يصير عندنا geniovarum يعني the knee deviates into a medial direction. okay. deformity. بس قبل لا نروح عن الكلينيكال فيتشرز بخصوص البين اللي قلنا بيصير بيه relapse and remission. What is the cause of pain؟ ليش يصير عندنا pain؟ احنا لأنه اتفقنا بأنه الكارتلج it is avascular, aneural, lymphatic, ما بي لا blood vessels ولا nerve endings ولا lymphatic vessels. Actually, the pain comes from multiple causes, comes from multiple sources. أولاً synovial hypertrophy, يعني يسوي لنا kind of synovitis. ولذلك بالبداية مع المحاضرة قلت لكم بأنه some call it osteoarthritis. They think it is inflammatory. There is a component of synovial hypertrophy, synovitis, هاي واحد. بعد الشغلة الثانية the capsular fibrosis اللي حكيناه قبل شوية، قلنا it is one of the pathological features. The fibrosis itself, it's painful. بعد more importantly the what is called intraosseous hypertension. Intraosseous hypertension يعني kind of increased venous pressure inside the bone which is adjacent to the joint suffering from osteoarthrosis. So these are the causes of pain in osteoarthrosis. ملاحظة بسيطة hand osteoarthrosis مثل ما اتفقنا in the hand the DIP اللي هو distal interphalangeal joint it is affected more ومن يصير عندنا osteophytes بهاي المنطقة يسمونها Haberden nodes. Okay. ومثل ما تعرفون أنه distal IP joint could be affected by certain other joint conditions. On top of the list is psoriatic arthritis. في حين proximal IP joint والMP joints affected more by rheumatoid arthritis. ومن يصير عندنا nodes around the proximal IP joint and rheumatoid arthritis إلها اسم ثاني they call it Bouchard nodes. وأكيد أخذتوها بالروماتولوجي وبالفيزيكال examination. بس اللي يهمنا هنا هو DIP joint والهابردن nodes. Another joint affected is the carbo-metacarpal joint اللي هو first carbo-metacarpal joint اللي هو it connects between the carpal bones and the thumb. Okay. وبعد ملاحظة أخيرة أنه hand osteoarthrosis it's more among female. So this is an X-ray of a hand with osteoarthrosis of the DIP joints. شوفوا loss of the cartilage. شوفوا شلون ال PIP joints they are less affected or even spared. وبعد شوفوا nodules أو nodes the Haberden nodes on both sides of the joint. This is a photo, same condition, distal IP joints suffering from osteoarthrosis. See the nodes on both sides of the joint and see how the joint space is decreased. Then, clinic complications of osteoarthrosis. إيش ممكن يسبب لنا؟ ممكن يسبب لنا in the knee joint capsular herniation فيسوي لنا Baker's cyst. Baker هو اسم واحد. Baker's cyst. فيجينا البيشنت complaining of a swelling in the popliteal fossa and when we examine it turns out يتبين عندنا بأنه it is a cyst. ليش تصير؟ It is because of herniation of the capsule with synovial hypertrophy and oversecretion of the synovial fluid فتتكون cyst we call it Baker's cyst. بعد loose bodies والloose bodies حكيناها قبل شوية قلنا osteophyte تنفصل من مكانها و it becomes as a free moving object inside the joint. بعد complications in the spine ممكن يصير عندنا certain conditions راح نجي عليهن regional orthopedics of the back اللي هم spinal canal stenosis و spondylolisthesis. اوكي راح نجي عليهن in both conditions in the future. اوكي هسه treatment. Our last section in this lecture is about treatment. بس قبل ما نحكي على treatment you should be familiar with the X-ray signs. The X-ray signs. احنا شفنا X-rays شفنا ال pathological features. all of you should be able to diagnose osteoarthrosis by X-ray because they are easy to see and مثل ما حكيناهم اللي هم first decrease أو joint أو loss of the joint space. مثل ما اتفقنا أن joint space الفراغ مال المفصل يكون because of the cartilage. فلما يكون عندنا loss of the cartilage either partial or total راح نشوف بأنه joint space يقل. وبالنسبة للمفصل اللي ركبه مثل ما اتفقنا أنه these changes they occur more in the medial side. بعد مثل ما حكينا قبل شوية راح يصير عندنا subcondylar sclerosis, subcondylar cyst formation, osteophyte formation إلى آخره. These are the X-ray signs of osteoarthrosis. All of you should be able to diagnose osteoarthrosis, especially when it is moderate or severe, just by X-ray. What is the non-operative treatment? The non-operative treatment starts with analgesia. Analgesia. So you should provide analgesia, maybe non-steroidal anti-inflammatory or paracetamol, etc. But the gold standard of non-operative treatment is physiotherapy. Physiotherapy is to keep the joint mobile. خليه يتحرك. لأنه if the patient doesn't exercise the joint راح يصير عندنا decrease motion. بالمقابل راح يصير عندنا muscle atrophy. والmuscle atrophy راح يسبب لنا more stiffness, more joint instability, more cartilage destruction. It's always our job to keep the joint mobile and the muscle at its best possible fitness. بعد load reduction. قلل load on the joint. On the top of the list is obesity مثل ما اتفقنا. The patient when obese should lose weight. وبعد we can ask the patient to use a stick يعني عكاز أو كذا حتى to decrease the load on the joint. ممكن intra-articular injection. وعندنا two kinds of injections inside the joint, either steroid injection or hyaluronic acid. تذكرون بالstructure of the cartilage قلنا it is a ground substance and cells and collagen fibers. For the ground substance it got hyaluronic acid and proteoglycan. For الشركات الأدوية they can provide hyaluronic acid as intra-articular injection as a trial to treat osteoarthrosis. But actually it's controversial. The role of steroid is confirmed. يعني الستيرويد محسومة النتيجة مالته it is beneficial. But for the hyaluronic acid it is controversial. Many say that it is useless. Operative treatment, we got different kinds of surgical procedures that we can do for osteoarthrosis. تبدأ من joint debridement. Joint debridement يعني it is kind of arthroscopic procedure. يعني نستعمل النافور ونحاول ننظف الجوينت from inside, from all the shreds of cartilage, loose bones, osteophytes, loose bodies, ونسوي partial synovectomy. وقلنا احنا يصير synovial hypertrophy اللي هو بالمقابل راح يسوي لنا recurrent effusion ويسوي لنا pain يسوي لنا swelling. فsynovial hypertrophy ممكن treated by partial synovectomy. بعد ممكن نسوي drilling يعني نثقب العظم نثقب cartilage and the bone, and it was proved that drilling the affected areas ممكن it help regenerate the cartilage. Okay. بعد realignment osteotomy. تذكرون قبل شوية حكينا أنه in case of osteoarthrosis for example الني شو يصير عندنا deformity؟ يصير عندنا geniovarum يعني يصير عندنا leg deviated medially. So one of the procedures that we can help the patient with ممكن نعدل الجنيوفارم لأنه more geniovarum, more load on the medial side, more osteoarthrosis and etc. It never stops. In such a case we can help the patient by doing realignment osteotomy. نعدل الجنيوفارم or also can be done for other joints. بعد arthrodesis هو عبارة عن عملية دمج المفصل fusion of the joint, surgical fusion of the joint. As a surgical fusion of the joint إحنا ما نحبذه لأنه in such a case you cancel the joint, no more motion. بس in certain situations it is the only option. بس يعني it is decreasing, it's becoming out of favor with the advances in arthroplasty. طبعا ال gold standard treatment for osteoarthrosis especially بالadvanced stages هو الارثروبلاستي يعني joint replacement. Okay. These are x-rays. It shows hips and knees with various treatment options. الصورة الأولى اللي على اليسار نشوف a hip with osteotomy ومخلين plate and screws. ليش؟ لأنه مثل ما اتفقنا to treat the deformity. فبهيج حالة نغير الوضعية مال الجوينت realign the joint بحيث نقلل اللود on the affected region. كأنه نغير الorientation of the joint بحيث نخلي اللود يجي على منطقة that's fresh, it is new حتى نقلل اللود on the affected region. الصورة اللي بعدها للهب نشوف أكو arthroplasty يعني joint replacement. الصورة اللي بعدها على اليمين نشوف arthrodesis. نشوف hip and it is fused وأكو intramedullary device. It is inside the femur and the pelvic bone. الصور اللي جوا هما for knees. أوكي للركبة. شوف الصورة الأولى هي realignment osteotomy. شوف بأنه أكو قطع جوا الني. It is osteotomy to decrease load on the medial side. بعدين arthroplasty joint replacement in the middle. وآخر شيء it is arthrodesis يعني joint fusion اللي قلنا it is falling out of favor ويستعمل أقل بوجود الارثروبلاستي. بس أحيانا نحتاج نسوي arthrodesis لأنه يكون الارثروبلاستي is kind of contraindicated like in severe neuromuscular weakness or in case of active infection. in such a case we can't do arthroplasty. فيكون the only option in hand هو الارثrodesis. And I think this is all about osteoarthrosis. It is kind of a huge subject, but if you keep in mind these outlines, you can add more information. يعني you can depend on yourself and add more information. بس الشغلات المطلوبة من عندكم واللي يحتاج تعرفوها هي هاي general outlines. This is the end of our lecture. عندكم أي سؤال؟